Hello, good evening and welcome to TVB News. The city reported 11 COVID-19 cases, 10 local infections, and 1 imported case. 5 local cases were identified through the Universal Community Testing Program. 1 more elderly patient died from the disease, bringing the death toll in Hong Kong to 98. Pinki Wong reports.
Among the local infections reported today, 5 are related to the Transport City building cluster in Taiwan. Officials called it a small-scale outbreak as 9 patients have so far been linked to this infection cluster.
Currently, we found some transmission in the 6th floor and the ground floor. That's why we have already quarantined all the ground floor working there, the people working there. For the 6th floor, because there are 12 tenants, and we found cases in 4 of them. 1 tenant has 2 rooms, so we think the 6th floor tenants are maybe at high risk than other people. That's why we put them under quarantine. As for the other floors, we are distributing specimens to test whether there are other cases in other floors.
5 other local cases are detected through the Universal Community Testing Program, with 4 of them of unknown origin and 1 linked to a previous cluster. Patients with unknown sources of infection include a woman who's in 33 weeks of pregnancy. She's a dispensary officer at a Chinese medicine clinic in Prince Edward. She's now in stable condition. All 30 staff members of the clinic will be tested for the virus. The other patients include a man who lives in Lam Tin and works at an Ao Tau Kwok Chinese restaurant, a male retiree who lives at Shak Wai Kwok Estate in Chun Wan, and a housewife who is a resident of Choi Hong Estate in Ao Chi Wan. The imported case involves a foreign domestic helper from the Philippines. So far, more than 1.16 million people have registered for the mass testing scheme. Over 1 million specimens have been collected, but more than 820 people have taken the test more than once. Secretary for Civil Service Patrick Nip said it's understandable that some people may want to take the test again as they feel worried after seeing someone or visiting places with a risk of infection. Nip said only a small number of people got tested repetitively, and the system itself allows this. Pinki Wong, TVB News.
The government pre-ordered roughly 2.5 million doses of a possible COVID-19 vaccine, but a local medical expert is warning the medicine may not prevent infection. Jacky with more.
As Hong Kong joins the global race to procure vaccines, some are already saying they might not ensure complete immunity. That's according to Gabriel Leung, a medical expert from the University of Hong Kong. Still, he also reminds people we should not be quick to dismiss their potential importance to the community. That's because the future jabs, once available, could prove vital in flattening mortality rates among elderly patients and those with chronic diseases. Given any vaccine could alleviate symptoms and complications from COVID, these high-risk groups would be given priority once the jabs are available. But there are concerns over whether any vaccine can protect against the various strains of the coronavirus. That's after a patient came down with COVID twice, first in Hong Kong and again in Europe. Dr. Leung says the vaccines procured would cover different strains of the virus. Still, he said people may have to get their shots again from time to time, as they may only be viable for 9 to 18 months. Leung expects the vaccines ordered to hit the market in the second half of 2021. Jacky, TVB News.
The Faculty of Medicine of the Chinese University says its new stool tests have picked up COVID-19 patients missed in nasal and throat swabs. Researchers are working with the government to test kindergarten children with this method. Hailey has more.
Nasal and throat swab tests for COVID-19, like other tests, could return false negative results in some patients. Since March, Chinese university researchers have offered free stool tests at the airport to more than 2,000 children arriving in the city.
Many of the patients, some of them who actually have negative on their sputum, on the respiratory swab, we are able to detect the stool positivity in the children. So if we had not done the stool test in some of these children, they would have been missed. This stool test may actually pick them up very easily and quickly, non-invasive, and prevent further transmission within the population.
They've also analyzed the stool samples of 15 local COVID patients.
The question is about when a person whose saliva sample become negative and the possibility that the stool remain positive. And actually, this is the cases that we come across.
3 people who were discharged from hospitals after their respiratory swabs tested negative twice still had the coronavirus in their intestines for up to 6 days. This discovery is the first ever of its kind in the world.
So your personal hygiene, especially in the toilet, and is very important.
The team says stool testing could be a better testing option for those who may have difficulties in collecting their saliva, throat, or nasal samples.
We are now working to the Department of Health to roll out the first stage of 2,000 children to look at how many of them actually may be asymptomatic and carrying the virus.
Hailey, TVB News.
The annual Tai Hang Fire Dragon Dance Parade is the latest casualty of the COVID-19 pandemic. The 3-day event is held during Mid-Autumn Festival each year. This year's parade was scheduled between September 30th and October 2nd. Every year, the spectacle of fire and smoke can be seen along alleys of Tai Hang and Causeway Bay. The ritual commemorates both the plagues and healings that befell the area back in 1880.